Hello and welcome to another edition of Medical Today. I'm Jared Rutnam. Very interesting subject matter we have for you in the next hour. But as always, we'll begin with the aging and well-being. And to do that, we have our usual suspect, Dr. Navendra Nageswaran, Group Medical Director of Global Doctors. He's also joined by Dr. Gillian Yeo, the Managing Director of Grands Unlimited, which happens to be a daycare for seniors. Now, what are we talking about today? We're talking about the importance of strength training in aging. Welcome to the show, Doc. It's good to have you again. Dr. Gillian, thank you very much for taking time off your busy schedule to be with us today. Now, there's so much to be answered with regards to strength training, but as we age, we now know that we need to start exercising. At what age does muscle mass and strength begin to decrease? Maybe you can start with this, Doctor.
Yeah, I think it starts from the age of 30. Every decade, we actually lose about 3 to 5% of our muscle mass. And as we grow older, and when we are 75, it actually hits the worst. And then 80 onwards, we become frail. So if we start doing strength training, like what you just said, that will change things around.
Right. Dr. Gillian, just let me move on to you and talk about strength training for seniors. Now, how often should seniors do strength training?
Well, actually for seniors or for any one of us, both aerobic exercise and also strength training are very important to our health. And according to the Center for Disease Control, right, it is recommended to do 2 to 3 times of strength training every week. And for aerobic exercise, it's recommended for like maybe 3 to 5 times in a week. Yeah, about 30 to 60 minutes.
Right, but doing exercises like these, you need someone to point you in the right direction.
Not really. If you are doing like aerobic exercise, it could be like cardio exercise. You can do cycling, all right? This you do not need someone to give you a guide or monitor. Right. You can actually do running exercises like even hiking. These are also considered as aerobic exercise. But for strength training, and then of course you need someone to recommend the right strength training for you. Like if you're not very sure as in what kind or how much of a strength you need or you can able to perform, then you definitely need that advice.
Right, Dr. Navin, they say that when you build muscle, you're preparing for your older age, especially in your 40s. Whatever exercise you do, you need to be cognizant of the fact that you know what muscles you're working on. Now, I think before we get there, the other question would be, can seniors build muscle? Is that a relevant question?
Yes, seniors can definitely build muscle. It is basically, you shouldn't lose the muscle. The first thing, you shouldn't lose it. So we have to be active. We have to come out of a seat and start walking. This Apple Watch with 10,000 steps is actually good. You just have to keep walking if you do the 10,000 steps. So walking itself is already building up some strength training. Then you do some resistance training, as what Gillian said just now. You go to the gym or you work out in a place or you go cycling. That's all resistant. So basic strength is getting up, squatting, and there are so many other things that you can basically do at home itself without doing anything else. Like what she just said, 150 minutes is recommended by the CDC a week. But generally, if you calculate the number of hours we actually sit in our chair and against what we're doing, that will give you the answer for strength training.
Right. Now, with regards to strength training, I'm coming back to you, Dr. Gillian. Let's talk about you using exercise equipment. Now, a lot of people can't go to a gym or they don't want to go to a gym. So you want to do it in the comfort of your home. Nowadays, we're looking at bands, exercise bands. Is that resistant bands? Is that recommended for seniors?
Yes, definitely. For seniors, for a start, they should actually do body weight strength training or resistance training using whatever body that the strength that they have in their body to start off with. And once they become more comfortable with it, then they can increase the strength or increase the resistance level, like the band, the exercise band and all that. They can buy, a certain band that which has a better or more stronger resistance towards it. This is what is recommended.
Right. Now, I think the other thing we want to talk about today is sarcopenia. Can you just give us a brief overview of what sarcopenia is?
Sarcopenia is loss of muscle mass, and at the same time, your body muscles are weakening. So to strengthen them, number one, you have to eat well. That's the first thing we need to do. Higher protein, higher diet. So sarcopenia is preventable if you were to be active. Basically, active lifestyle is what's needed for sarcopenia.
Now, when you talk about an active lifestyle, there's another saying here. A lot of people say that, you know, once you pass your 50s or your 40s, you need to be careful of the exercises you do because your bones become brittle too every time you exercise. So I don't know if there's any truth to this. Maybe you can walk us through this, Dr. Gillian.
Well, I would say that is because as we age, right, we tend to have a lot of mobility issues, like you know, it is kind of hurt to our joint as well. So most of the time, all the trainings, regardless whether it's strength training or resistance training, all you have to do is take care of your joint.
Yeah, I guess that's one of the downers, you know, when you try to do a squat or a lunge and, you know, you feel joint pain. Yeah, but, you know, over and above that, I think, let's go back to what we're talking about, sarcopenia now. You know, what are the classic symptoms of sarcopenia?
Basically muscle weakness, tired, fatigue, and becoming frail. See, as your muscles, you need your core muscle strengthened. If you don't have your core muscle strengthened, neuromuscularly, the whole system will start to fail. It's like a car. If you just keep it stationary and you don't move it, the car, the next time you want to make it run, it won't move as fast as what you want it. The whole electrical system will fail. The human body is the same thing. So you have to become active to make it good.
So they say the go-to standard or the mecca of core exercises would be, let's say, take for example, Pilates. Now, are there Pilates for
yoga? I think Pilates, yoga, all of them will. Tai Chi. Tai Chi is excellent because it's got the resistance component and it's got the strength component. Because there's lots of resistance in Tai Chi that actually builds up neuromuscular. So not only do you build up muscle mass that you're going to lose eventually, but you will also simultaneously build up neuromuscular strength, which is very hard to build.
Of course, when you talk about exercises, I mean, off the top of my head, the first thing you can think about is your legs. Your legs need to be strong. But why do you say the core first?
It's not just, well, I wouldn't say it's just the core part, because the core, as we know, you know, for elderly, they tend to have a lot of musculoskeletal problem, which is the back problem. And also that has really got to do with the core training, the core and the back extension. And of course, not to forget is our lower limb, the leg. So squat come into place. And also the push-up, which is target the upper body. Yeah, so all these components, right, I would say is very important. So you shouldn't just look at one part of it.
Right. So I wanted her to add on that for the core is because, like, you know, we've been always talking about our gold standard here, a 94-year-old Prime Minister. Horse riding. That was what I was keeping for. Horse riding is something that you build up your core, so you're straight. So you need, so that it's already building resistance and you're able to do that. So that actually does help a lot.
Now, when you talk about sarcopenia, are there treatments out there for sarcopenia?
There are drugs. There are known as adenocorticotropics. There are also HRT. But you know HRT that women take, there are a lot of side effects, and the effects are detrimental to your whole well-being.
But there are medications for treating sarcopenia.
In a worst-case situation,
There are some that's being investigated too at this point.
Yes, correct, absolutely right. But I would still think the simplest treatment would be active exercise. That's it.
So is there a cure for muscle wasting? I guess that's the...
There is a prevention.
There's a prevention, there's no cure for it.
There is a cure which is reversible. You just have to do twice if you lead it towards damage of your muscles or loss of muscle. To build muscle back takes you longer time compared to losing it. So if you prevent it, then you don't have to work double time.
Right. So when it comes to sarcopenia or anything which is related to muscle wastage, exercise can reverse this, right?
Yes, definitely.
Right. So when we choose exercise, what do we need to think about, all of us, regardless of age?
Yeah, regardless of age, I would say when you're talking about the exercise, first of all, you need to set yourself a goal. What you're trying to achieve, okay?
But it should be exciting also, isn't it?
Yes, you have to make it exciting. Yeah, so Yeah, so after that, you have to look at your the plan. You have to start planning on the exercises that you're going to do, whether it's 2 times in a week or 3 times in a week. Then after that, you should also, I mean, especially for the elderly, you should take into consideration of your balance.
Right.
Yeah, your balancing. Yeah, then the fourth one will be coming back to, you know, your warming up exercise. How long are you going to design your warm-up sessions or your cool-down sessions? That is actually more for those who are not so used to doing exercise and they need some recovery time.
Right.
Yeah. So because for the first time after they started their exercise, right? After a long period of time, they have not gone into a gym or exercise routine, they might feel muscle soreness.
Right.
Yeah. So then you have to.
And that's only normal if you get muscle
Yes.
soreness.
Yes.
But there are also people who talk about using collagen. Now, is there any truth to this?
There is yes and no again, but there are no proven studies to prove it. But collagen does help, like starting from your joints and all that. But you have a lot of side effects. The problem is you've got a lot of heartburn, reflux, nausea, digestive dysfunction, and as you grow older, digestion system also tends to slow down. So we wouldn't want to encourage that. The simple day-to-day activity would be the best way to prevent and to also regain all the losing muscles due to age.
Right. Dr. Gillian, I'm going to have you have the last say. Well, give us 5 strength training tips for older adults. We've got about 40 seconds left.
Yeah, I would say first, of course, is to know your objective. What is the goal that you're trying to achieve?
Yeah.
So when you are in your 60s, let's say, so you set a very realistic goal, as in what you are trying to achieve at your age, not when you were in your 20s. Then secondly would be your plan, your strength training plan.
Goal, plan?
Yes, yeah. Then third one is the warming up exercises, all right?
Right.
And of course, not to forget to take care of the joint as well. Yeah, recovery time and.
I'm going to make it very short. So step, squat, lunge, walk, jog, hop, and skip. And that was a tip by Dr. Navin and all our friends at Global Doctors. Thank you very much. It was a pleasure to have you all here. And we do hope to have you in the studio again at some point to talk about exercising when I become a senior. Thank you very much. Thank you very much for staying with us right here on Medical Today. We'll be back just after a short break. Stay with us. This is Medical Today on BNC.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Astro lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye. Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Hello and welcome back to Medical Today with me, Jared Ratnam. From what we spoke about just now, we now move into myopia control. Now, it simply means nearsightedness and is the most common cause of impaired vision in people under the age of 40. And in recent years, its prevalence is growing at an alarming rate. Now, joining me is Farah Azalia Mizan, an optometrist from Optocare Group, to talk about myopia control. Farah, thank you very much for being with us or for joining us. Now, let's just start with a very basic question about myopia. What is myopia?
Myopia is actually a scientific term for nearsightedness. It's a elongation of the eyeball, our own eyeball. We can't focus very well because due to the long eyeball of the shape of the eye compared to the normal eye. So the focusing of the vision is in front of the retina, which we're supposed to focus the vision on. So when it happens, we get blur vision, especially below, like you said, below 40 years old of age. And it's tremendously attacking all the youngsters nowadays at early childhood.
Right. So I'll give you a chance to clear your throat while I talk about this. Now, in recent years, there's a prevalence and it's growing at an alarming rate.
Correct.
Now, why is this? Is this because of the dawn of the internet age, social media, people are in front of the computer screens? Why is that?
Like you said now, when we walking into a house, like when we unplug the Wi-Fi, everybody like, oh, hello, what happened to Wi-Fi? Because the tablets and the gadgets are all around us nowadays. So we can't actually say when is the good time for screening for kids, because that thing is like just nearby them.
So is it safe to say that we now have a myopia epidemic in the world?
It's safe to say that.
Right. So what does it mean for optometrists? You know, does it mean more studying, more understanding of how we can stop myopia or slow it down?
At the moment, there's no studies that we can prevent myopia from attacking of onset.
Don't buy computers for your children.
Yeah, but the prevalence is alarming because in 2010 it's only about less than 50 population of the worldwide is myopic. But by 2050, I think the prevalence said it'll go more than 50% of the population is myopes.
So if we want to simplify it a little bit more, what are the risks of a myopic eye?
The risk when we have myopes, the risk is actually if you have high refractive error, so later on in life you might get pathology like disease of the eyes.
Okay, to even simplify it for those of us who don't understand, what is a refractive error? How would you?
Refractive error, the one that you are using right now,
Yep. Okay.
is specs. You correct your refractive error of the eye, which cause the myop.
Right. So specs essentially helps to correct the refractive error of the eye. Right.
The term is dioptric, the power of the, it called dioptric power of the refractive error. Like just now you said, there's textbook and studies, you can't prevent myopia from happening, but you can slow it down.
Right, right. So now when you talk about myopia, what is myopia control? What does it actually mean when we say our topic is myopia control? So what does it actually mean?
Myopia control is at the moment in worldwide is a program or treatment to slow down and the progression of the myopia actually. It's not to prevent from it happening, but to slow it down, especially at childhood age. As like all optometrists advise, as our practice in optometry care, we also advise children to drop by to any optometry practice to get their eye tested as early as 3 years old onwards to see whether they have symptoms of myopia or not. And we can start from there.
So with regards to treatment or fixing this, what options do we have in Malaysia and also outside of our country?
In Malaysia, is the famous options in Malaysia at the moment is, of course, spectacle correction, special lens correction, which is multifocal lens and multifocal contact lenses to correct the myopia control. And the recently one in Malaysia it's not quite recent actually, but a few years back already. Most of the optometrists has been practicing it. It's called autokeratology, which you sleep with contact lenses. I'm
not even going to try to pronounce that, okay?
Autokeratology means, the short form is ortho-K.
Ortho-K.
Ortho-K. If you heard ortho-K, it means at night you sleep with the lens And then daytime, you're free of spectacles or contact lenses. So you can do most of the activities.
Right. If you take a look at the different age ranges, what's the age range at which it's still possible to control the progression of myopia? And what's the most effective way for controlling it at this point?
Talking about age, as in my practice, we start correcting the patients that are about 7 to 13 years old already. Yeah, you can walk into any optometrist clinic and ask for this program so that they will monitor the children from age 7 until they are teenagers.
Right. And the most effective way of controlling it?
The most effective way at the moment, we can't actually, there's a most effective way because there's
so it's different with different individuals, isn't it?
Yeah, we have to do eye test first and then, but the common one is multifocals, contact lens and spectacles, which is very useful for the children to adapt. And auto is, since AutoK is new, and you can ask the option at the optometrist.
I don't know if this is the right question to ask, but you know, when you look at it, people always say with degeneration of something, people always ask if you can reverse it. Now, is there a possibility of reversing this? You're smiling, it's bad news for us.
So, unfortunately, if you don't have parents with myopic or you don't have a quiet myopic refractive error, there's no chance of reversing the myopia actually.
Now, okay.
But we can slow down the progression.
We can slow down the progression. So when we slow down the progression, there are also other things that can be done. A lot of people talk about foods that are good for eye health.
Right.
You know, they've got, I've been to, what do you call that, the pharmacy, and I see a lot of supplements for eye health now.
Well, you can
so,
still,
yeah, what is your advice or your tip with regards to this?
For talking about remedies, you can still advise children, especially youngsters, to get their vitamins, veggies, broccolis, all that, and carrots at your childhood age to prevent all those diseases later on. But once myopia occurred, you have to slow it down by taking all these, by using all these treatments.
Right. So you need to eat your vegetables, with carrots being one of them. Okay. You know, they always say carrots are good for your eyes. I never knew why.
Vitamin D's and and for youngsters, since they like gadgets so much nowadays, right? So we advise them at least minimum 2 hours outdoor activity, at least, so that they can refocus their strength of the eyes rather than.
So outdoor activity
is very good.
In the sun, of course.
Yeah, of course.
You know, just tell your children, go out there, sun.
Play.
There's something called a sun outside. Ada matahari kat luar.
There's sunblock. You can use sunblock if you worry so much.
So this is very important. Going out and playing in the sun and upping your levels of vitamin D. Yeah.
Limit the gadgets times indoor and.
How is that possible?
Even
I mean,
my children.
You have children.
Yeah.
Do you find it possible to limit gadget time?
So we have to be a very firm parents there.
Yeah.
But what you can do while they're using the tabs, you have to monitor the length of the position of the tabs and the gadgets, not too close in front of their eyesight, at least the arm length.
Right.
So like that. So. And then the lighting have to be very fully equipped, not in dark room or on the bed without any room lights, because it's really harmful actually.
So in short, no gadgets in the room, in the dark.
If you can do that.
Yeah. Well, let's take a look at one more question for you. What's the long-term risk for high myopes, so those of us with high power, so to speak? Is it true that these risks are not mitigated even though if they go through LASIK or other corrective work?
The long-term myopes, if they have high refractive error later in life, they might have ocular disease like retinal detachment, means our focusing area of the eye get torn.
Right. So
because of the stretch of the eyeball, the length of the eyeball is stretched. That's most of the common symptoms later on if you don't prevent it. That's why we have to really advise children to go for as early as possible eye tests at any optometrist practice.
Right. But before I let you go, Farah, what's your one tip you want to tell all of us with regards to myopia control? Or that piece of advice you have for us before we close?
So the topic today is about myopia control, and usually it's related to children because late or adult already got myopia. We can't reverse that, or we can't even slow it down when we are adults. So please bring your children to any optometrist practice and get a proper comprehensive eye exam, and you can ask about myopia control to the optometrists themselves.
Right. Farah, thank you very much. We just spoke to Farah Azalia Mizan from Optocare Group. She's an optometrist, or trained optometrist to be exacting, joining us talking about myopia control right here on Medical Today. We'll take a short break and come back just after a break. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Astro lenses go beyond my correction. Their creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello and welcome back to Medical Today with me, Jared Ratnam. We have a very interesting segment for you right now, talking about heart attacks. Now, warning signs of a heart attack. Are you at risk? This is always a question we need to ask ourselves. Now, our host, Nurata Amin, spoke to two very interesting people from the Regency Specialist Hospital. She spoke to Dr. Paul Ling Ka Hing. He's the resident consultant cardiologist. She also did speak to Fung Mok Yan, who's a dietitian from the Regency Specialist Hospital. Let's take a look at this video.
A heart attack or myocardial infarction is a life-threatening condition that could occur to anyone at any time due to existing conditions, known or unknown. Heart attacks may be presented by a variety of symptoms, the most common being chest pain, shortness of breath, and tingling in arms, shoulder, or jaw. Identifying the symptoms early can save a life. Let's find out more, and also the treatments, preventive measures, and contributing factors that lead to heart attack. Dr. Paul,
hi.
It's good to have you with us on Medical Today.
You're welcome.
So, what is myocardial infarction, or as we call it, heart attack?
Okay. Myocardial infarction is a serious medical condition. It actually happens when there's an acute blockage of one of the blood vessels that is supplying the heart muscle. It occurs and is actually a life-threatening event. Because of the blockage of the artery, damage will set into the heart muscle, and the heart muscle will become irregular, and suddenly the patient can develop what we call a cardiac arrest, in which the heart stops on its own. So it's actually one of the conditions that is the very commonest cause of cardiac death in the young and in the older population.
So, does that cover the types of heart attacks?
There are multiple types of heart attack that we are aware of. A heart attack basically just means damage to the heart muscle because of an interruption in blood supply. The one that we are most concerned about is what we call a ST segment myocardial infarction. This occurs suddenly, acutely, commonly in the 40s and the 50s, where there's actually a blockage of the artery because of a blood clot inside. This is a condition that is life-threatening. People have to be aware that they have this condition when they have the chest pain and to seek urgent treatment as soon as possible. Otherwise, the mortality and the prognosis for a heart attack is very poor. It's estimated about 30% of people who have what we call an ST elevation myocardial infarction never make it into hospital. They actually die at home because of a cardiac arrest. So it is also very important that we are aware of it. And nowadays, a lot of people in the public knows a little bit about what we call cardiopulmonary resuscitation, or CPR. This is basically a procedure that can be learned in which we will try to actively restart the heart by pumping the chest to provide blood flow to the rest of the body and to the brain when the heart is stopped while we are waiting for urgent medical treatment.
Right, so in your opinion, what is the contributing factor to developing heart disease?
There are multiple risk factors for developing heart disease. High blood pressure, diabetes, overweight, elevated cholesterol level. These are all what we call risk factors. One of the risk factors that is actually the most serious cause of a sudden acute heart attack in the younger population is actually smoking. Smoking is prevalent in Malaysia. About 40% of Malaysians actually smokes, and it's actually one of the countries where smoking is actually more frequent in the young. In other parts of the world, smoking is actually reducing, but in Malaysia, it's still increasing. Smoking actually harms the blood artery to the heart because it causes the blockage of the heart to become unstable, in which there will be a blood clot, the acutes happen suddenly and blocks the blood flow to the heart artery, causing a heart attack. So of all the risk factors that we have in causing a heart disease, smoking is actually the one that we can actually prevent. Because this is something that we, from our willpower, should be able to stop. The rest of the risk factors, like your genetic risk factors, your descendants, your race, these are certain things that we really cannot control. If we are born in a family where there's a very bad history of a heart problem, there's something that we really cannot alter. But smoking is something that we should be able to change.
Right. How about cholesterol, doctor? What is the safe level to maintain your cholesterol?
Okay. Elevated cholesterol has been associated with heart disease, and it's been proven in many clinical trials that elevated cholesterol is a predisposing for developing heart disease. Now, in terms of how high your cholesterol is, it depends on a few factors. One of it obviously is food intake, which is very, very important in maintaining what we call a good cholesterol and reducing your bad cholesterol. The other thing that we really have to be concerned about in cholesterol is that certain parts of high cholesterol is due to what we call genetic factor. We are actually born with our genetic makeup that we cannot clear the cholesterol from our body, hence increasing in elevated cholesterol level. So people who have heart disease should be taking medication to lower their cholesterol as much as possible. Even if people with heart disease have a little bit of elevated cholesterol, they should already be on treatment to lower it, because cholesterol is a high predisposing factor for developing heart attack and complications of heart attack. In terms of the absolute level, it depends on your risk. If you have a high risk, then your cholesterol level should be lower than a person who has low risk. But the most important thing about cholesterol is awareness. If you have a family history of someone who has a high cholesterol heart disease, please get your cholesterol level checked.
Right. So doctor, could you kindly explain how would a doctor treat this disease according to its severity?
Okay. Now it depends on the presentation. If the patient comes in with a heart attack, we have to go and do something urgently. We have to do a procedure in what we call coronary angioplasty or stenting. It has to be done to prevent complications to the patient. This is the first thing that we do if patient comes in to us with a heart attack. The sooner we do it, the better the prognosis is for the patient. For certain other conditions where it's not so acute, where it's not a heart attack but the beginning of heart disease, we have to do what we call an angiogram to see what the condition of the artery is.
All right, coronary angioplasty and stenting. So besides that, how does it work compared to other alternatives such as coronary artery bypass surgery?
In coronary angioplasty and stenting is actually a minimally invasive procedure. Okay, in the procedure, what we actually do is we make a small cut or incision in the hand of the patient or in the groin of the patient, in which we thread a very long catheter up all the way to the heart, and we find out where the blockage of the heart artery is. Once we identify where the blockage is and what is causing the problem in a heart attack, we thread a very small wire and a balloon across the blockage, and we open up the blockage with the balloon. After the blockage has been opened up with a balloon, we actually put in a stent. A stent is basically a metallic spring, and we insert or put the stent in where the area is blocked in to prevent re-blockage of the area.
Right.
It's actually a minimally invasive procedure. The patient doesn't need to have any general anesthesia. It is normally completed in 1 to 2 hours. Patients love having this procedure done compared to other alternatives. In other alternatives, in patients who have very severe blockage, including all the 3 arteries or in multiple blockages, and if they have diabetes, then sometimes they have to go for another more invasive procedure called a coronary artery bypass surgery. In this procedure is actually an invasive procedure requiring at least a week stay in the hospital and in ICU, where a blood vessel is actually taken from the leg and from the chest and is what we call grafted into the blockage to basically bypass across the occlusion to provide blood flow to the vessel. So coronary angioplasty and stenting is now the routine preferred first-line treatment for a heart attack because it's non-invasive, it's actually less fussy, and it actually provides very good data and prognosis to the patient.
All right. So now we want to focus on time, of course. As you said, you have to treat it as soon as possible. So time is an essential factor in treating a heart attack. So how much time does a person have to survive the attack before it is fatal?
Okay. Now the first thing to know about timing is the heart muscle. The heart is basically a muscle. The sooner the treat it, the better. The longer we leave it, the heart muscle will die during a heart attack. Okay? So the first thing that your patient has to be aware is they have to recognize that this is a heart attack. And not just pain. In some people, they get profuse sweating, they faint, and this could also be signs of a heart attack. So the first thing is there to be aware that this is a heart attack and seek urgent treatment. I have told you already that nearly 30% of people with a heart attack die at home. They never make it into hospital because of what we call a cardiac arrest. Of those that make it into hospital, 10% still die in the hospital despite best medical treatment. So time is of essence in getting the patient into the hospital. Once the patient is in our emergency department, in our emergency room, then we will do what we call an electrocardiogram, which is the ECG reading of the heart. If this confirms a heart attack, then we have to get the cardiologist to come in to do the coronary angioplasty and ballooning treatment. This is potentially life treatment. So most hospitals will have a guideline in terms of how fast we should proceed to treat this patient. So most international guidelines say that from the time that the patient comes into our emergency department to the time that they get treatment, it should be not more than 60 minutes if possible. The faster, the better it is for the patient.
So I think any prevention of, especially for this disease, should start at a tender age. So what would you think the best way to educate our young ones?
Okay, I think obviously the best way to educate the young one is basically a promotion of a healthy lifestyle, a reduction in sedentary activities. We are now launched with epidemics of handphones, smartphones, computer, myself included, my children included, and I have addiction to handphone nowadays. I think that is a very bad epidemic that is going on. Sedentary lifestyle leads to obesity. Okay? And obesity is a great predisposing factor to not just a heart problem, but to a whole host of other problems like early diabetes, high blood pressure. Okay? In the past, we know that diabetes people normally get it in the 40s, 50s, but now I'm seeing children in the 10s, in the 20s who are starting to develop diabetes because of this sedentary lifestyle problem and this weight problem. So I think active promotion of healthy activities, family bonding activities, of physical education, exercising, jogging, these are something that we really have to inculcate in our young population. The government is imposing sugar tax for soft drinks. I think that is also a very, very good example of cutting down dependence on sugar and to prevent complication of diabetes and high blood pressure and obesity in the young population.
So what measure would you take as an individual or of course as a professional doctor to create awareness for prevention for this disease?
Okay. As a professional doctor, I think we have to depend not just on individual effort, we also have to depend on a collective effort. As an individual, I think most doctors, if they have the knowledge, please pass that knowledge to the younger generation. Okay, I also teach in a medical school. I think inculcate your teachings, explaining to your fellow colleagues the importance of risk factors in prevention of heart disease, giving thoughts to them, giving thoughts to parent-teachers associations, schools. These are a way of passing on knowledge and also example to the younger population. Collectively, as a group of doctors, together with our medical association, I think we should also be lobbying the government in terms of prevention of heart disease. I think sugar tax is something that is good for the general population. There are thoughts about cutting down opening hours for mama shop, which I think is an excellent idea in terms of reducing problems of obesity and consumption of food, especially in the late evenings. So I think this is something that the medical association and the doctors as a collective should also be lobbying the government on.
So doctor, mind sharing with us the challenges that you face with your patient or the challenges that your patients have gone through treatments before, during and post?
Okay. A lot of patients eventually will have what we call atherosclerosis. Atherosclerosis is basically hardening of the body blood vessel because of age, because of diabetes, because of high cholesterol. The patients have to be aware that this is a progressive condition. It will never be cured. What I am seeing as a cardiologist is actually a patient who already had this heart problem, who comes in with a heart attack. So what I am actually doing is to prolong their life, treat them as best as I can when they're having a heart attack. Unfortunately, as human beings go, a lot of the time, once the patient is well after a heart attack or had the angioplasty done and they went home, they forgot that this atherosclerosis is a lifelong condition. Some of them forgot to take the medication. Some of them go back to smoking. In fact, I would say majority of them go back to smoking. Some of them will go back to their old stressful lifestyle, with no consideration of dietary restriction. So every time when I follow up this patient, it actually saddens me to hear that they have actually gone back smoking, they have actually gone back to their unhealthy lifestyle. I really had to keep emphasizing that this is actually, unfortunately, a lifelong condition. There's no cure for it. What we are actually doing is to treat it as best as we can.
Right. Thank you, Dr. Paul, for the good inputs that you have shared with us on Medical Today.
For the patient with heart disease or high cholesterol, the dietitian will do a comprehensive nutritional assessment including a diet recall with the patient. Based on the diet recall and the patient's culture, we will give them a proper nutrition interventions by educating them how to identify the types and amounts of the oil they can consume, understand the food nutrition label, and also provide them some tips to do some lifestyle modification. Basically, they have two types of fats, good fat and bad fat. Good fat is unsaturated fats such as omega-3, 6 and 9. It can be found in those deep-sea fish like salmon, tuna, sardine, and some plant-based food like avocado, nuts and vegetables oil. For the bad fat, it is considered as saturated fat and trans fat. These two types of fat can be found in those red meat and coconut oil, palm kernel oil and butter. These two types of fat will increase our bad cholesterol, which is called LDL cholesterol, and reduce the good cholesterol, which is HDL cholesterol. Nowadays, many people were concerned about the margarine and butter. In the market, they have two types of margarine, soft margarine and hard margarine. For the soft margarine, it's mixed by those vegetable oils such as sunflower oil and olive oil. It contains high amount of unsaturated fat. While for the hard margarine, it contains high amount of the trans fat and saturated fat. Well, for the butter, when we look at the nutrition fact, it also contains high amount of the saturated fat and some amount of the trans fat. That's why, as a dietitian, we are not recommend them to take the hard margarine and also the butter. According to the American Heart Association, there are 4 lifestyle changes which help us to reduce the risk of getting heart disease. First, follow the heart-healthy diet, which means that we lower down the saturated fat and trans fat intake. At the same time, increase the dietary fiber intake from the fruits, vegetables, and whole grain. And also, we have to be careful about the salt intake. Second, be physically active. We recommend the patient to do at least 150 minutes of exercise per week, such as jogging, brisk walking, swimming, and attend some fitness classes. Third, to be concerned about your body weight. By losing about 10% of your current body weight will help us to reduce the risk of getting heart disease. The last one is to stop smoking and drinking. As we know, smoking and drinking will increase your risk of getting heart disease.
That was our very lovely Nurata Amin speaking to Dr. Paul Ling, a resident consultant cardiologist from Regency Special Hospital, and also Ms. Fong Mok Yan, a dietitian from the Regency Specialist Hospital, talking about warning signs of a heart attack. And the question is, are you at risk? Please go check with your primary healthcare specialist if you have any signs. Well, stay with us. We'll take a short break and come back with our final segment right here on Medical Today.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eisen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never-tired Dragon Eye, Eisen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
Hey there, this is Medical Today. I'm Jared Rutnam in our final segment of Medical Today, or episode 5 to be exacting. We're going to take a look at another video. Every week we bring you a video in our accidents and incidents segment. Today we're taking a look at a video talking about wound dressing by Makota Medical Center. So it's a very, very interesting video. Let's take a look and see what insights we can take back from this video.
This is a demonstration on wound dressing. Here is the step-by-step instruction. Number 1. Prepare the standard dressing items, which are sterile gloves, apron, mask, non-sterile gloves, dressing set. Ensure patient is in a comfortable sitting position. Wear apron, mask, and latex gloves to remove patient's wound dressing. Perform hand hygiene. Open the outer layer of dressing set. Perform hand hygiene again. Wear sterile gloves. Perform dressing. Use correct aseptic technique while doing the dressing. Clean the wound from clean to dirty area without touching other areas. Discard all used dressing items, then remove gloves and masks. After removing gloves, discard all used dressing items and masks. Lastly, perform hand hygiene as it is the single most effective action to reduce infection.
Another very interesting video there for you right here on Medical Today. That was something about wound dressing by Makota Medical Center. We hope to bring you more videos of that nature right here on Medical Today. Now, if you do have any questions for us, please do send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. And we'll get doctors and subject matter experts to reply to your questions right here on the show. Next week on the show, we'll be talking about prostate cancer or diseases of the genitourinary system, a big word for us to delve into. I will be having Dr. Thanabalan V. Sivaratnam, a resident consultant urologist from Makota Medical Center, joining us right here on Medical Day. On that note, I'm Jared Ratnam signing off. We certainly do hope you had a fantastic time right here with us today on Medical Today, Episode 5. Jared Ratnam signing off. Have a great day ahead.